Not one, but two IPOs this week, which means we have like an entire portfolio of stocks practically in health tech. Matthew Holtz, it's the September 18th episode of Health in 2.0.
Or is it the Health in 2 IPO? Just trying.
Health in 2.0 IPOs. Oh my God, things have gotten ridiculous. The look on my face, I can't even, it's like literally stunned me with your stupidity. No, I'm joking.
Well, there were two IPOs, and the one thing I'll say before we get into what they are is that both the IPOs involve people who've been in the original Health 2.0 on the 3 CEOs panel that we used to have, right? So,
oh my God, it all comes
from
together.
Outset and Roy Schoenberg from American Wealth. Both been on that sort of featured CEO about when things would be. But I would point out that Roy was on it, I think, in 2008 or 2009. So it took him a long time.
Which I have to say this, I feel kind of bad for these companies that are going public right now in the middle of this pandemic, because it's like they're missing out on that moment of like having everybody on stage and ringing the bell.
Don't worry, they're not missing out on their moment of them all putting huge amounts of.
I don't know. I feel sorry for the fact that they're.
Well, although to be fair, the ones who are going public right now are not able to put cash in their pocket right yet because they still have their 6 months to figure it out. And who knows what the stock market will be like in 6 months, or what the world will be like in 6 months if we'll still be here. But anyway. I
don't know, but Glenn Tolman, every time I've ever interviewed him, has said the best thing about going public is the day you go public. Yeah, and then after that, it's all kind of downhill.
That may be true.
So I feel sad that the folks at Amwell and Outset didn't get
Glenn Tolman wasn't a poverty-stricken young man about, about to buy his first big house after it. But although he seems to have done all right since then, I get
Yeah, we're not worried about Glenn. All right, get your timer ready. Let's do this. Let's talk about these IPOs.
Okay, I've got the old timer back because I've lost my other phone. But ready, steady, and go.
Okay. All right. Amwell's IPO finally, after how many years? How did it go out? Do you think it went better than expected?
Yeah, well, I think it went about right. So I noticed that Teladoc stock bounced up a bit as well on the consequence of this. It's about a third the size of Teladoc. If you look at the market cap, which is about 5 billion and change at the moment, traded it bounced. Yeah, it's got a decent bump up from the range. A lot of demand for it, right? They sold more stock at a higher price, and it bumped up about 30%. It's actually a good IPO for them. Not so good for idiots who bought on the IPO open. Just what I thought.
No, it's going to take a bounce. All right, what about whatever? Warren Buffett is in this. Google's in this. I have complete confidence in Amwell. Okay, Outset Medical also IPO'd earlier this week. Tell me about this one.
Outset Medical. These are for the people who aren't familiar. This is the Leslie Trent CEO. This is the home kidney dialysis machine. It's basically, it's been in development for a long time. Very cool. Probably will be a revolutionary piece of dialysis. Their IPOs double. They're not quite the market cap of Amwell, but their market cap's around about 2.5. They went out about a market cap of about 1.5. So it's more than doubled. About 1. It's more than doubled. So it's a great IPO. And I think that's going to be I would say it's going to be a sleeper, but it's already doubled. So we'll see.
Well, here's another potential sleeper that's going to IPO later, maybe. Ready. They raised a $54 million C round. Google Ventures is in this. Town Hall. This is like right after another $40 million raise a couple months ago.
Yeah, and they got a lot of publicity for this. This is where they should send texts to the home who do telehealth, and they've got a connection with Teladoc here. They've been doing a lot of COVID testing work, and they've been doing a lot of stuff in New York. They've been doing a lot of Medicaid work. And in fact, this is, if you like, it's a bit like a sort of mobile version of Cityblock, Medicaid specialty medical group. It is part of the new way of the world, right? Doing care at home, using technology. It's a lot of money to come in very quickly, so a lot of interest there.
Yeah. All right. What about Lifespeak? They get $42 million.
Yeah, this is kind of videos. We just got me on there.
Timer Rooster. Always happy to hear him.
This is a Canadian company, which is that's a lot of money for what they're doing, because which is basically, this is kind of like a service for employers, for EAPs. Employee programs. It's basically YouTube. with an interesting selection of videos. So it's not live. It's a cheap service whereby you can get information as an employee or employee can provide information to your employees, which is on all kinds of performance and coaching issues at work. A ton of it is around mental health, meditation, that kind of stuff. And it's sort of, you know, it's like a video management system with a bunch of experts providing their videos. You know, there's a lot of this kind of stuff. There's a lot of this stuff going on. There's always been these medical video people. It hasn't ever, none of them ever, the sort of self-servicing, ever busted huge, but it's hard to imagine you could charge that much for it because it's a bit of a commodity and you have to be with YouTube, but somebody believes in it. Not sure.
I guess so. Hey, somebody should believe in us. I'm somebody with a whole bunch of YouTube videos. I
we have videos. Yes. Where's all 42 million?
That. Why not? If people are paying for that content, why wouldn't they pay for this?
Absolutely. We also didn't. By the way, that it's Canada. You've missed on Twitter, and maybe we can tease it for next time. A whole bunch of fascinating health policy wonkery stuff about you're not fascinated about about telehealth in Canada and how come there is telehealth in Canada when it's private and they only have a public only system, and deals in Canada and the UK and Sweden showing that you know this socialism that Joe Biden is going to impose in the world and kill everybody or whatever Trump is saying. Well, apparently the places with the most socialist healthcare systems apparently have capitalism and telehealth.
Hey, who knew? Save it for the next episode, buddy. The all international.
We'll tell people so about the details.
So you can get your fix in.
That's called a teaser in the business, Jessica.
No, this is called I think I'm so smart on Twitter and want everybody to go look and see what I have to say about this right now. I can't even wait till the next episode. Don't even try to convince me that I don't know what's happening here. People have already had to hear him go on and on about this. It is quite interesting, but yes, we're going to save it for next time. And in the meantime, if you just can't wait, please, by all means, go to Twitter, find him at BoltyBoy and argue with him about socialism, Canada, the UK, the Swedes, telehealth, all of those fantastic things that he loves to rant and rave about. See if you too can get his blood pressure to go up. Don't forget, DTX always does it. I'm over at Jess DeMassa. Ping me, please, if you want some ideas about how to put a bee in his bonnet.
I measured my blood pressure the other day compared to the first show, and it was, I'm going to have to show you what it was. It was way lower. Oh, my God. I was back the next morning. Hang on.
And in the meantime, while you're looking for that, I'm just going to remind people that they can go to the healthcareblog.com and sign up for our e-newsletter there to get curated content from the blog delivered right to your inbox, so you don't have to stress out, and your blood pressure too can be whatever we just saw flash on the screen.
Mine was much lower than it was.
Okay, good.
It's not good.
Maybe it's lower me that jacks your blood pressure. It might be me. All right, guys, have a great weekend. We'll see you soon. Who knows what's going to happen next? Thanks for watching this episode of Health in 2.0.